Good morning. I'm Giulia Melis. I am an urban planner and I work at Links Foundation, a research institute based in Torino, northwestern Italy, where I devote my daily work to guide a research program focused on city climate and environment. With my team, we focus on the challenges that cities face every day in terms of both climate change, but also social issues, and to support public administration in taking informed decisions and to activate solutions and interventions to counteract those challenges. Well, Earth observation data have brought a sort of revolution in urban planning, as they are an enormous source of information which we didn't have before. So they really changed the way we take decisions. They can be used both to validate traditional way of assessing and analyzing data, as well as to expand our knowledge. For example, if we think about heat, the way we collect data has changed since satellite data are available, because before we had to rely on sensors and on modeling techniques, while nowadays we have a real-time picture of the temperature, for example, on the surface. This brought a real change in how we plan our interventions. Another important example is how we can use real-time satellite data regarding other emergencies and other challenges. If we think about, for example, flooding, wildfires, it is extremely important to have those data because it gives you an opportunity to act on time and to activate emergency responses. So it's a truly life-saving knowledge and technology. Our service combines Earth observation data with health data, and therefore we want to offer new knowledge to cities to really understand vulnerabilities. So the focus of this tool is to support public administration into taking informed decisions in a context of scarce resources, so to prioritize interventions. I think this service is important both to activate solutions in the short term. So if we think about targeted communication, to be able to warn people about the risk when there is, for example, a heat wave coming. And here I would like to open a parenthesis emphasizing how important it is to have a targeted communication able to reach all the groups, taking into account also cultural and social barriers, and to use health as a key message, because it really opens and raises the interest of people, and in parallel, so to warn people, and in parallel to activate some services like indicating where fresh places and climate refuges are located. In the long term, we offer public administration map of priority areas where to intervene. As I was saying, we are in a context of scarce resources, so it's really important that decision makers intervene where it is most urgent, which means where we have the highest risk of heat, but also where the most vulnerable population resides. And that's why we decided to combine the two data to really be able to spot where people are at risk due to their social and demographic characteristics. So we take into account where the oldest population is concentrated, and also if they had some previous diseases that increase their vulnerability. Therefore, decision makers have this indication, this map, and also an idea where they could implement some targeted solutions.